Welcome, everybody, to the Functional Medicine Show. I am here today on a solo episode as Sean is on vacation this week. Very well deserved vacation, might I add. And so we're going to kick things off here in just a minute. All right, so for this week's episode, really just wanted to drop in and do a quick update on lots of things going on within FMPHA and the Functional Medicine channel here on RPH Ally. So if you follow us on social, hopefully you've seen by now, we are doing a town hall meeting tomorrow night, Thursday, June 15th at 7 p.m. Eastern Time. You can click the link for the Zoom that's been posted everywhere, and we'll make sure that you can access that in all of these places, wherever you're watching. But the purpose of this town hall meeting really is to get everyone up to speed on the future vision for Functional Medicine Pharmacists Alliance and how we can bring all the pharmacists together to really see through this mission that we have of making functional medicine the standard of care through pharmacist-led clinical services. So that's a pretty big ambition, and it's not going to happen overnight. It's also not going to happen just in silos with one person working on their own. And so the goal is really to bring together anyone and everyone who is interested in learning about ways that we can collaborate and work together for the betterment of the profession, really, as well as patient care. We know, as we've talked about in lots of previous episodes, that you can go back through and watch, that functional medicine is here. It is definitely the future of patient care in getting to the root cause of chronic diseases, utilizing lifestyle medicine, integrating all of these different modalities that pharmacists are starting to use in their practice, from pharmacogenomics to, nutrition or looking at supplements and so much more than that, right? Again, really this lifestyle focus. And then really creating these new business models and new ways to implement this type of care in any practice setting, whether in community pharmacy, independent pharmacy, hospital, or health systems. If you're out there building a business in consulting, like so many of the amazing people in the RPH Ally community are, there is a role for functional medicine. And so we really want to bring everyone together to talk more about the strategic plan and the vision that we have for bringing this to the forefront. And so I invite you to join in on the meeting that we're going to have tomorrow night at 7 o'clock, so that you can learn more about how to get plugged in and actually take some of these steps both for yourself and in terms of advocating for the role of pharmacists, right? Because this is very much a two-way street. We need to have more pharmacists getting trained and plugging into the functional medicine community and showing up and showing what a pharmacist can do. But we also need to bring this functional medicine knowledge into our traditional pharmacy settings, and so that we can actually revolutionize the profession together. And so we have a lot of ways that through FMPHA, we plan to support pharmacists in doing that. And working with groups like RPH Ally is a big part of that mission, in being able to bring this information to more pharmacists through continuing education, through business training and entrepreneurship training, from virtual networking in Facebook and the RPH Ally platform and all the places wherever you're hanging out watching this. Also in-person events. I've personally just gotten back from a wave of travel through events like A4M and IFM, Healers in Healthcare Conference. You can go back again, watch all of the previous live episodes that we've done, recapping those incredible experiences. And there's going to be so many more coming up this year. So if you're not subscribed to the newsletter, you can visit fmpha.org/newsletter. And that way you'll get all the updates and be able to stay tuned to the events coming up, both online and in person. A couple of the events that we're really excited about, again, we have our town hall tomorrow, but there's also events that we're planning for the fall, like our Functional Pharmacy Symposium, which will be September 22nd and 23rd. The 22nd is really just a kickoff networking reception that FMPHA hosts. And then the 23rd is the full day of functional medicine CE, right? And we're talking about cardiometabolic disease and inflammation and drug-induced nutrient depletions, all really foundational concepts for pharmacists to know and understand and be able to implement on Monday when you get back into your pharmacy setting. So those are just a sampling of some of the things coming up. And then beyond those, we also are thinking about advocacy. And again, all the work that's being done to position pharmacists as part of the solution to the chronic disease epidemic and utilizing all of our skill sets to expand the care team, expand the ability for all of us to work together as providers and create the best possible outcomes for our patients through that interdisciplinary care. So that's just a really quick sneak peek at some of the things we'll be discussing tomorrow night during the town hall. And really, we'll be diving more into ways that you can get involved in this mission, in this work that we're doing. Because again, I can't do it alone. You can't do it alone, but together we can work together and really see this through to its full potential. So I hope you're excited, and I look forward to seeing you guys tomorrow night on the call. If you have questions, feel free to drop them wherever you're watching, and we'll be able to answer those for you as well. So thank you so much for everything you guys do in terms of supporting this channel, supporting RPH Ally, just being part of the community. Showing up is the first step, and it's such an important piece of the equation. And just taking that first step, taking that step of faith in order to say, you know what, I'm not going to settle for the status quo. I'm not just going to be relegated to the old ways of working. I want to be part of the solution. That's what it's all about. So we'll see you tomorrow night at 7 o'clock on Zoom. Take care.